Hello everyone, welcome to Remedy 24. Today we're going to show you why is your poop black. Stools are usually brown in color. Stool color can range from pale to dark brown, depending on the meals eaten and the amount of bile present. In certain instances, it may even be green. Stool color is usually unimportant, but there are times when it should be evaluated by a doctor. Stool that is black in color should be taken to the doctor since it could suggest the presence of upper gastrointestinal bleeding. Black stool, on the other hand, can be caused by eating particular foods or taking certain drugs or supplements. Number 1. Iron supplements and black poop. Iron is required by the human body to generate hemoglobin, which aids in the movement of red blood cells throughout the body. Iron supplements may be used to avoid anemia in those who have a lot of blood loss, eat a low iron diet, or require more iron owing to situations like pregnancy or poor iron absorption. While iron supplements can help the body build up its iron reserves, they can also have unfavorable side effects including black stools. Heartburn, constipation, stomach pain, and cramps are all possible gastrointestinal symptoms. People who are experiencing these adverse effects should get medical assistance from their doctor. Number 2. Bismuth subsalicylate and black poop. The medicine bismuth subsalicylate is used to treat diarrhea, heartburn, and stomach distress in adults. It reduces intestinal inflammation, decreases the number of fluids and electrolytes entering the intestines, and may kill bacteria that cause diarrhea. Bismuth subsalicylate can induce black stools, and a blackened tongue is a side effect. These side effects are normally harmless and go away once the person stops taking the drug. Ringing in the ears and incorrect urine sugar testing are two other possible side effects. Number 3. Foods that cause black poop. When you eat a lot of certain foods, your bowel motions may turn black. Blueberries, black licorice, and dark leafy vegetables are all common culprits. Consuming 2 or more ounces of black licorice daily for 2 weeks or more may lower potassium levels in the body, leading to heart rhythm abnormalities, elevated blood pressure, lethargy, swelling, and congestive heart failure in people over 40 with a history of heart disease or high blood pressure, or both. When black licorice eating is stopped, the side effects fade away with no long-term consequences. Number 4. Bleeding ulcer and black poop. Perforations known as ulcers can form if the lining of the digestive tract is injured, and bleeding can result. The stool may seem black and tarry as a result of the bleeding. Ulcers can induce heartburn, bloating, nausea, and sensitivity to fatty meals and are often caused by the bacteria Helicobacter pylori, H. pylori, or excessive use of non-steroidal anti-inflammatory medicines. The risk of ulcers is increased by smoking, eating spicy foods, consuming alcohol, and having untreated stress. Number 5. Esophageal cancer and black poop. Esophageal cancer is characterized by abnormal cell growth in the esophagus, the food line that connects the throat and the stomach. This disease may have no symptoms at first, but tumors eventually develop large enough to prevent food from being swallowed. Stools may appear black if there is bleeding in the esophagus or elsewhere in the gastrointestinal tract. Anemia may be caused by bleeding, with symptoms such as pallor, lightheadedness, and weariness. Number 6. Stomach cancer and black poop. Stomach cancer, which can cause bleeding in the stomach, is another probable reason for black stools. Anemia can occur as a result of the bleeding, much as it can with esophageal cancer. Bowel alterations, such as diarrhea or constipation, thin stool, and variations in bowel frequency, may be seen by someone with stomach cancer. Nausea and vomiting, a loss of appetite and weight loss, exhaustion, and stomach pain and bloating are all possible symptoms. Number 7. Mallory-Weiss tear and black poop. A Mallory-Weiss tear, or damaged tissue in the lower esophagus, can cause black or tar-like feces. This illness is commonly caused by violent and prolonged coughing or vomiting, but it's also linked to alcoholism, hiatus hernia, chest trauma, chemotherapy, and inflammation of the stomach or esophageal lining. If there is a lot of blood loss, the person may go into shock and collapse. The bleeding usually stops on its own, but if it doesn't, cauterization, blood transfusions, and the use of the vasopressor pitocin are all options. Number 8. Esophageal varices and vascular malformation. Large veins grow in the esophagus as a result of a blockage in blood flow to the liver. If they bleed, they may have black, tarry stools, as well as jaundice, and they may vomit blood and coffee ground like vomit. When blood vessels in the gastrointestinal tract lining don't grow properly, they expand to the point that they can burst and hemorrhage. Dark, tarry stools may result if this happens. It's also possible that the person will vomit blood. Number 9. Diagnosing the cause of black stool. Before performing a physical inspection of the rectum and anus, the healthcare professional evaluates the person's medical history and symptoms to establish the source of black stool. They'll probably do a fecal blood test to see if there's any blood in the stool. Endoscopy or colonoscopy, procedures that allow examination of the intestinal tract to help determine the source of the dark stool and other gastrointestinal symptoms, may be performed on the person. Stool cultures and blood testing are examples of further tests. Number 10. Preventing black stool. A healthy lifestyle may aid in the prevention of illnesses that result in black stools. Avoiding smoking, limiting alcohol use, and taking non-steroidal anti-inflammatory drugs can all help. It may also assist to follow the directions for taking iron supplements and stomach treatments that contain bismuth subsalicylate. To avoid a recurrence of black stool and concomitant symptoms, people healing from gastrointestinal bleeding should take their medications exactly as prescribed.